Be honest, between stress, no sleep, and caffeine, your blood pressure has probably been through a lot as a college student. But how do you even take a blood pressure? Today, I'm going to show you how to take a manual blood pressure the proper way. As a nursing student, this is a skill I have learned and have been tested on. So I'll go over the right supplies you need, proper client positioning, step-by-step process, and how to interpret reading numbers. So to begin, I'll show you the supplies we need. So first, you will most likely need a pillow for propping up your patient or whoever's blood pressure you're taking to prop up their arm. Then you'll need a stethoscope, and then you'll need a proper fitting blood pressure cuff. If a blood pressure cuff is too small, it could give a false high reading, and if it is too large, it could give a false low reading. So next, to properly prepare whoever's blood pressure is being taken, you have to make sure that they are sitting, make sure their feet are flat on the floor, and make sure their legs are uncrossed. Next, you have to ensure that their forearm is at the same level as their heart, and make sure that your patient has not, or again, whoever's blood pressure you're taking, that they haven't had caffeine, exercised, or smoked in the last 30 minutes. And then you have to make sure that you have the proper cuff placement. So here, you can see that there's artery markers. So to find the artery, you have to find the radial pulse, and then diagonal from the radial pulse is the brachial artery, and that is where you want the arrows to line up on the blood pressure cuff. So you want to put it about 2 inches above where you felt the brachial artery, and then go ahead and secure it and make sure it's nice and tight. So now that we're all set up, I'm gonna have, it's easier to have whoever's blood pressure you're taking hold your gauge so that you can easily read the numbers and pump up your bulb and listen all at the same time. So your first step is to take an estimated systolic pressure so you know what to pump it up to. So for that, you're gonna hold the radial pulse and you're gonna pump it until you can't feel the pulse anymore. So it disappeared at 120. So that means we're gonna add 30 to that for taking the blood pressure. And that's what we're gonna start listening to. So we're gonna start listening. We're gonna pump it up to 150. We're gonna place the diaphragm of your stethoscope right over the brachial artery, and we're gonna pump it up to 150. And then as we get to 150, we're gonna slowly release the air in the bulb. So we're gonna pump it up. We're at 150, slowly release, and listen for our first thud. Our first thud came around 105, so we're listening for the last sound now, which came around right around 75. So our first number is 105, and our second number is 75. I'm just gonna remove this to ensure that they're comfortable. So the first number that we got is the systolic number, or the systolic pressure, which is the top number of blood pressure, and this represents the heart contracting. The second number is the diastolic number pressure, which represents the heart relaxing. So our patient's blood pressure was 105/75, and this is normal. It's a little low because the normal blood pressure is 120/80. And so today we went over how to properly take a manual blood pressure, and as a nursing student, this is a skill that I've been able to master. We went over what supplies you need, how the patients should be positioned, the step-by-step process, and what each number represents. Any questions?
Are there different blood pressure cuff sizes?
There are actually different sizes. You can have smaller ones for infants or pediatrics, and then bigger ones for overweight clients. Any other questions?
What's it called when a patient has high blood pressure?
High blood pressure is called hypertension. So.